Good afternoon, everyone. It's Dr. Gershon with another Endeavor Better Health webinar. I'm absolutely thrilled to be here today with a colleague and a friend who I consider a real visionary and thought leader in the world of healthcare and public health. It's Dr. Sandro Galea. He is the Dean of the Boston University School of Public Health and the Robert A. Knox Professor. First, as I do with all of the webinars, I really want to thank everyone who has attended our webinars and our podcasts in the past. The support that you have given to the platform encourages many of our partners in Techstars who are driving and accelerating early stage healthcare companies with tremendous entrepreneur CEO founders who look to people like Dr. Galea and others for leadership, for a sense of what true north might be in an era where novel science and technology are reshaping our health and our wellness every day. Before introducing Dr. Galea, I do want to pay tribute to a fantastic leader who Dr. Galea and I both felt was a mentor and somebody who played an important pivotal role in our lives, which is Alan Rosenfield. He was the Dean of the School of Public Health at Columbia. This is a webinar in part in tribute to Alan, who was a great human being, an advocate for women's health, and a true leader and visionary in the world of public health. In part, we're also here today to hear about Dr. Galea as an accomplished, published author of many, many important books. And he will tell you about his new book, which I think in and of itself offers up tremendous interpretation of the role of leaders in our era of novel science and technology and digitalization. So without further ado, I'm going to introduce you to Dr. Sandro Galea. Sandro, if you could tell us a little bit in brief about yourself and then the vision that you see going forward for the leadership within medicine and within public health to be able to address large healthcare issues in this era of digitalization and technology on the heels of arguably what has been one of the greatest crises in public health in our history.
Well, first of all, thank you for having me on, and thank you for mentioning Alan Rosenfield, who, as you said, was a mentor to me as well as he was to you. I think we're in a really interesting time in health and medicine, more specifically. We have been through the largest health crisis in 100 years. We have come through it with, as a country, we have had more deaths than any other country in the world, at least as documented. But at the same time, we also arrived at vaccines in a record period of time. Millions more lives were saved by that and by many other public health measures. So I think we're at a time of where we're emerging from real challenge, and I think challenge that shows opportunity. But I think it's also challenge that sows other challenges. We have seen from opinion polling, for example, that confidence in science, in medicine, in health is at an all-time low. There's been about a 25-point drop in public confidence that health scientists have the right intentions and they're helping the public since before COVID. That's extraordinary, actually. It's extraordinary, particularly given that objectively health did a lot of good during COVID. So I think it's a time for careful rethinking. I think it's a time for asking, what did we do well? What did we not do well? Why is it that people are trusting us less? And how do we make sure that they do trust us more? And, you asked me to talk a little bit of myself. I mean, I serve as a dean of School of Public Health at Boston University. I'm a physician by training. And I think those experiences, both my clinical experience combined with my public health experience, combine to put me in a place where I try to think carefully about what is it that we need to do collectively to generate health for as many people as possible. That's what I spend my time thinking about. And my newest book tries to think about that in the context of the COVID pandemic, in the context of after the COVID pandemic. And I think anybody who's in the health space, whether in the health technology space or the clinical health space or in the space of building a healthier world, it is a good time to think critically about what we do, how we do it, and why we do it.
Well, first of all, let me say that, the book is an extraordinary book. Within Reason, I think, is a compelling title. It is certainly met with a very interesting structure to the book, where there is a series of essays, which I believe each one can stand as a tremendously interesting discussion point on its own. But when you put them together, there are certain themes within this book. One of those themes, which we talked about earlier, is leadership. One of them is about decision making. How do we take responsibility for global health? How do we take responsibility for the use of resources, human and financial, to make decisions that are ethical and bounded by strong data and strong science, so that we know that what we recommend to people today is verifiable based upon our best understanding of the algorithms and the protocols within our scientific decision-making framework. So I would love for you to talk about some of the things that you thought about when you started creating the book. And then there are several different chapters which are beautifully captured within YouTube, which I would urge people to take a look at. And each one of these chapters, I think, has a significance. So first, take us on a inside Sandro Sunday morning. You're making a decision about what to do with the next year of your life, and a culmination of a number of things from COVID resonates, and you decide to write the book. What's the vision that you have and the message that you want to give to people?
I think the message is that twofold. Number one, it is a really important time to think about health. It is an important time to take stock and to say, what have we done? What should we do? And what should we do better? And, I published this book in December of 2023 intentionally. I didn't publish it December 2022. It wasn't time. We were too close to acute COVID to reflect. So number one is that I am encouraging, I'm explicitly pushing us to reflection. Now, number two is, what should that reflection be about? Well, that reflection should be about the broader question of why health. And I think this may be resonant to some people listening to this webinar. We often make the mistake of thinking of health for its own sake. And I think that's a mistake. Health is a means to an end. The end is living a full, rich, satisfying life. Health should be a way to get there. And in many respects, the errors made during COVID were errors in thinking that health was the only thing that matters. That we were willing to cast aside everything else just for health. And that's simply not the case. I'll use one concrete example. We went through a year where people were not allowed to be with their dying loved ones in hospitals because of the risk of transmission of COVID. And that is a misunderstanding of the priorities of us as humans, that we want to be able to give a kiss and a hug to our loved ones if they're dying, even if it puts us at risk of the disease itself. That is well demonstrated through human history, through the love, the sorrow, the joys, what makes us human. And we forgot that. We forgot that in the time of COVID. And we said, surely we can all understand that we should just be behind plastic, behind people who are dying. Well, actually, no, we don't understand that. We want to be with our loved ones when they're dying, because that is part of living. So I think what I'm pushing us to is to think about, what is the role of health? What is the role of health in helping us all live, in helping you live, helping me live, helping us realize our aspirations as autonomous humans?
I think, part of the message that really resonates I think with everyone is the common denominator that all people at some point in their life will get sick, and how they deal with that illness, how they deal with their wellness on a day-to-day basis says a lot about the quality of their life. The other thing is that illness does impact people around you, your loved ones, your family, your friends. And so there is a collective connection that all human beings, where we are in the world, have, which is grounded on our own humanity. Now, for me, as an investor, I look for great leaders who are using technology and innovation to improve the healthcare system and, most importantly, patient outcomes. Within this construct, AI, machine learning, and deep learning have become prominent buzzwords and prominent amongst investors to see where that technology can improve the quality of life. Part of that quality of life is being more in touch with your human characteristics, your core human behavior. And I think that this, in a post-COVID era, if I can use that, which may be too much of an extension of where we are in the world right now, but in an era where technology allows us to be able to free up our time more, create more productive medical products, services, and drugs, leadership in this context is quite important to decide how we're going to use our time. So one of the things that I see as a very important message within your book is the open discussion about difficult topics. And this democratic, liberal perspective about discourse, agreeing and disagreeing, and you talk in your book about how some of your colleagues might not agree with the things that you're writing about. So for me, leadership is embedded in many different words, and one of them is courage. And I want to highlight the fact that you are courageous, in my opinion, to be able to put out a book that many, many, many people will be reading. And as you said, there may be pushback. So I'd like you to talk a little bit about that pushback and about what the challenges are in a world that is less open to discussion and more driven to conservative thought.
Yeah, I anticipated and I worried about the pushback when I wrote the book, and there has been pushback to the ideas of the book, and I'm not worried about the pushback per se. What I am worried about would be a closing of mind and a rejection of the notion that these ideas should even exist. Perhaps my the greatest compliment that people have paid me with this book is people who have written to me and said, I disagree with a lot of what you wrote in the book, but I'm glad you wrote it. Because that, to me, suggests that we are willing to entertain difficult questions and we're willing to give them an airing. We are willing to accept that people of fair mind are willing to engage in conversation that entertains the possibility that we maybe disagree, and that disagreement is not necessarily disagreeable, that the disagreement is generative and can lead us to better paths forward. You talked about leadership, and I do think that in this moment, when there is such opportunity in health, it does require leadership that is willing to take the risk to think clearly, and that's not such an easy thing to do.
Yeah, these are challenges, I think, which go to the intersection of government, politics, corporate leadership as well. One of the things that we talk about all the time in our work. Hold on a second. I think I lost my video here. Oh, there I am.
You're back.
Yes. It is, how do you create a discussion platform where people with different perspectives and different needs can find a common language.
Yes.
And-
Yeah, it's an excellent question. I apologize, I didn't mean to cut you off. I think I leaned into answering just because I think it's an excellent question and one that I'm enthusiastic about, and it is in no small part why I'm glad that we're having this conversation. It is exactly these conversations that get these ideas out into the world. And I've been asked when I've talked about the book several times, like, what's next? Well, what's next is this. It's having conversations. It's creating the space to say, let us think about this. Is that guy who wrote this book right? Maybe he is, maybe he's not. Here's where I agree with him, here's where I don't. And I'm a firm believer in the notion that it is through respectful but analytical conversation that we move ourselves forward. And by ourselves, I mean as a health community, as a world.
So let's talk a little bit about how some of these ideas impact the School of Public Health, the educational platforms that you have really remarkably built out over the past years in your tenure. You have moved Boston University into a global leadership position. And I think I would like to understand a little bit more about this intersection of what I see as true leadership and courage and the risks that you've taken along this path. Because certainly you don't achieve what you've achieved over the past few years without taking risks.
Yeah, look. I think insofar as I've achieved anything, I've been blessed, and I've been very fortunate. I do think that I approached public health when I took over as a dean of the School of Public Health now almost 10 years ago, with a sense of mission and responsibility. And way back in 2015, I said, if I'm going to take a position like this, I want to make sure that I use it to help advance our thinking in public health. And that has meant tackling topics that at the time in 2015 were not in the public health conversation. For example, things like racism as a core issue for public health, things like the firearm crisis as an important issue that public health should grapple with. And that is really a line from there to now, where I'm trying to tackle the topic that says public health needs to think carefully about what it does, how it does it, to the end of doing better. And these topics are challenging to take on, and sometimes they do not fall on ears who are willing to hear them or who are a bit skeptical of what you're saying. And one needs to find the space where one can say these things and is still listened to. And that's it's an interesting needle to thread, and I have tried to thread that. At the same time, of course, I have institutional executive responsibilities in terms of making sure that we have an outstanding educational program where our students have the best possible education, and perhaps most importantly, are taught how to think. And in part, I see a synergy between taking on difficult topics, as I discussed, in a public conversation way, and leading a school that has responsibility for an educational program, because I think it helps students see that the role of public health is large, it's expansive, and hopefully it helps them shape their own thoughts.
No, I think that's spot on. And I would, again, circle back to the beginning, of the webinar, which is a thank you in memoriam to Alan Rosenfield, who was a true leader and a visionary and always enrolled people in his vision, but also gave them latitude to create their own vision and to provide those resources to advance ideas. Now, one of the things that you talk about is, where you grew up in Malta. You talk about the impact of political problems, violence, to some degree, an environment that was oppressive, and how this shaped your decisions on your life path to become a physician, but also has in some way exceeded your vision and exceeded your expectations, so that you now have a platform where you can pass on a tremendous amount of knowledge and information through your educational system, but also through your writing. I would like you to speak to one section of the listening audience, which is the young entrepreneur founder. The young entrepreneur founder believes that there is no mountain high enough that they can't climb over, there's no wall thick enough that they can't crash through, that their technology will save humanity. And while this may all be true, the reality of the situation is that we have a complex healthcare system, particularly in the United States, which has complex problems. And as part of that, these young entrepreneurs and founders need to know how to listen, to adapt, to be resilient, and to understand that the integration of their ideas on the innovation and technology side is in large part dependent upon large industry, large hospitals, large healthcare systems, embedding that technology into a large infrastructure. So I would like you to speak to some of the issues which cross over into your educational channel, which is creating new leaders in the world of public health and in medicine and in science. And what message do you give them? I'd love to hear your thoughts on that.
Sure.
Because a bit of that in the book as well, which is a fascinating read, and I recommend it to everybody.
Well, first of all, a direct message to what you characterize as the young entrepreneur founder. I think don't lose the belief that you can crash through any wall. Don't lose the belief that you can achieve anything you set your sights on, because that's how the world changes. And I have deep, abiding respect for everybody who thinks that way, who aspires to break through that wall. So number one, don't lose that. Number two, as you're thinking about health, please keep in mind that our health is not emerge from our healthcare. Our health emerges from the world around us. We are healthy because we have clean air to breathe. We have safe water to drink. We have food that is nutritious and not overly calorie dense, because we have opportunities to exercise. That is what makes us healthy. That is what keeps us healthy. And fundamentally, we want to stay healthy. Healthcare comes in to treat us once we are sick. So if we devote our intellectual energy, if we take that spark, the entrepreneurial spark, to lean into creating a healthier world, we are all going to be better for it. And my sense of the field is that there are opportunities for win-wins, where one can create entrepreneurial ideas that generate health, which are monetizable and which help the entrepreneur founder and their goals, but also help the world. And I would encourage any listener who falls in that category to think about that and say, what is the idea that is going to create something that keeps us healthy and that pushes us to be a healthier version of ourselves, that we don't need healthcare to begin with?
No, that's great advice. Never lose that fire in your belly, and at the same time, you've achieved things which few people have. That path means that you also have an ear towards the environment and the people around you, that you are, by default, have to be a good listener. And you have to understand the timing and the cadence of being able to drive your message through a system. Patience is important. Removing ego from the decision-making process is important, while still keeping that fire in your belly. And so one of the things that I read in this book is a lot about introspection, a lot about how well did we do? Can we do a better job? What were the strengths and weaknesses over the COVID era of decision-making? You mentioned a couple of them, which were barriers, which were artificially created, not necessarily scientifically grounded in all instances, which removed our personal decision-making and and took away our individual power to govern our own health and wellness. So I'd love for you to talk a little bit about that personal aspect of responsibility as it pertains to your own personal health and wellness.
Yeah, I certainly, I'm not effective if I'm not well and healthy. Neither are you, neither is any of us. And it is important, therefore, to pay attention to our whole. And by whole, I mean our intellectual well-being and our physical well-being and our emotional well-being. I'm not sure I have anything particularly brilliant to say on that, other than I try to be very deliberate about how I engage with with the world, both intellectually and physically and emotionally. And that means, to be completely frank, staying away from healthcare as much as possible, meaning staying healthy as much as possible. And I suspect that any listener to this who is ambitious and wants to make a difference, but also live a full, satisfying life, feels the same way. You know, one metaphor which I often use is the one of our car. You know, you want your car to drive and to do cool things. You don't want to spend its time in the garage. You know, you want to go to a garage as a last resort. And that's how I feel about healthcare. So I make an effort to make sure that I live in a way that promotes health and only use healthcare as a last resource. And I think most of your listeners would feel the same way, even if they necessarily haven't thought about it in such a structured way.
No, that's very true. Um, I would like to get a better understanding about how you chose the title Within Reach for your book. What is the
Yep.
thinking behind that?
Yeah, so within reason is really the thinking behind that is because I'm arguing in the book that there's no one approach that necessarily is wrong or right to deal with complex health issues. And the mistake we make is when we go all in without recognizing that there are different approaches. And COVID was a good example of that. Is it wasn't wrong to have everybody mask for a period of time. It was probably wrong to have everybody continue masking for a long period of time. And that's where it's within reason, where we need to have the judgment to say, when is something reasonable? What is that line that we want to find where we do the things that we need to do to constrain freedoms for the sake of promoting health, but not overdo it? You know, I use in the book the example, for example, of China's zero COVID policy, which was really not within reason. It was an effort to do something that was unattainable and that essentially imprisoned tens of millions of people. That is not within reason. Now, I realize and I say this in the book, that the question of what's reasonable is debatable. But that in some respects is the whole point. As long as we're open to having the discussion of what's within reason, you and I can have the discussion and we can agree or we can disagree. And ultimately, hopefully, we have societal structures that are responsive, adaptable, transparent to draw a line for us. You know, one of the other points which I make in the book is the notion, for example, of follow the science that became a bumper sticker during COVID is a mistake, because that suggests that science has a linear answer. This suggests that science tells us one thing and we should act on that one thing alone. And that's simply wrong, because science is just one input. There are other inputs. There's the input of what we value. There's the input of what joy we want to have. There's the input of what kind of education we want for our children, how much education we want for our children. Those are extra, outside of what a simple science answer gives us. So I encourage us all to have the humility to realize that our job is to generate the circumstances or the devices or the environments that allow people to be healthy so that people can then live their full lives.
Oh, that's fantastic. And really to finish off this webinar, I'd like to get a vision what you see happening in the world of public health over the next 5 to 10 years. You know, we're at an important inflection within science and medicine with incredible technologies. There are a lot of questions about how we can form ethical parameters around these technologies, which clearly will shape many aspects of healthcare, including electronic healthcare records, drug discovery, drug development, automated diagnoses, pathology, radiology. The framework is being laid down, and the leadership around the world is just beginning to address the next decade of AI, machine learning parameters. I'd love to hear your thoughts about the next decade in terms of public health and how some of this technology is going to impact public health decision making.
Yeah, I think it's a really interesting time in public health at the intersection of technology. As I mentioned at the beginning, I think it's a time of challenge, which means a time of opportunity. I think AI is inevitably going to play a critical role in some of the difficult decision making that public health does. I think that raises interesting questions of ethics and values and inputs that go into AI. It raises interesting questions about how we can create the better human machine interface, how the machine can augment human judgment but not replace human judgment. I think it creates opportunities for simplifying the gathering of complex data that historically has been really difficult to bring into one place, and for public health to really have all the data it needs to make informed decisions. So for anybody who's listening to this who is interested in these technologies, I think it is a wonderful opportunity. I had the privilege of chairing a global commission on using data to better understand the determinants of health to make better decisions. And you can find this, it's called the 3D report, Data Determines Decision-Making Report, which talked about the parameters we need to get better data to make better decision-making to generate health. And I think AI is going to help all of that. So I think it's a really interesting space. I think we should need to be careful to make sure that we do not overreach in a way that hurts us. There's been ample social conversation about that, but by and large, I am optimistic.
As am I, and I think, you know, part of the optimism is that I see incredible people coming to the forefront, collectively talking about what their concerns are, what they see as opportunity, and then putting together their resources to make really good decisions. Here in New York City, there is a new center called the Alexandria Healthcare Center. It's not that new, but it's new in the sense that it has now attracted some of the best and brightest minds in the world to advance drug development and drug discovery, and the Zuckerberg Foundation and Endeavor and other organizations are participating in the growth of that. Embedded in this is a tremendous effort in using digital technologies to advance drug development, drug discovery, and healthcare overall. And I think as part of this process, there are workshops, which I would love to invite you to discuss some of these issues about how do we use technology ethically and appropriately? How do we make decisions about how to allocate resources? What are the constraints that we should put in place? And what are some of the checks and balances which might not have been in place, as you wrote about in your book, within the COVID era? Each country, each government made their own decisions. You talk a lot about the disparities within the socioeconomic platforms, within the decision-making process, and how different socioeconomic and demographic cohorts were impacted in both short and long-term healthcare issues based upon the decision-making of governments to either open or close various environments. So I would love to be able to bring some of this discussion, you know, to New York City. I would love to bring some of this discussion into a larger public forum, because for sure we are going to face other pandemics in our history. And for sure we are going to have to be able to figure out how to use the resources and incredible technologies in a more humane way, in a way that brings together science and medicine, but in a uniform way that treats all demographics in an appropriately egalitarian fashion. So I would love your final thoughts about this important aspect, as you talked about things like social determinants of health and talked about bias in your book.
Yeah.
These are important things that leaders need to be address in an open public forum?
I think that one of the positives of COVID, and when one says that judiciously recognizing the human toll COVID took, is it surfaced that there is no health without everybody being healthy, and that many people are left behind in health, and it is our responsibility and the expectation of the world around us that we generate health for all. So I think there is an enormous moral imperative, but also a practical opportunity to do things that narrow health gaps and that reach people who have historically not been reached by health. You talked about the entrepreneur listening to this, and I would encourage the entrepreneurial ideas that tackle long-standing health gaps, that make sure that everybody has access to better health. And I think there is moral value in that, and I think there's also market value in that.
No, I think that's great. And I want to encourage everyone to really read, Sandro's book. Within, Reason, I think, has an important place in everyone's library. Each one of the chapters, as I mentioned earlier, is an essay unto itself, is a thought-provoking essay. I think, frankly, it's a seminal piece and appropriately timed, as you said, Sandro, because people are now ready to think about how can we deal with these important issues going forward. What was the impact individually? What was the impact to my community? What was the impact to my family? How can we learn from some of these experiences? And now we do have, the good fortune of coming out of this crisis stronger, healthier, financially well structured, and decision making from an investor standpoint clearly is focused in on solving the core healthcare problems. And so being able to have people like yourself at the decision-making table as an investor would be a tremendous value to the healthcare system. Bringing people from the academic environment into the discussion roundtable with industry leaders like Microsoft and Google and Apple, alongside all of the big biopharma, biotech, health tech companies, I think is an important step in the process, which to date has not necessarily been at the core of large investment decision making. So I would challenge people to be able to invite you to some of these events on the investor and strategic decision making side, because I think that your voice and your message in this book is an important one to consider in the decision making process.
Thank you. I enjoy interacting with people with the ambition to go through walls, as you articulated earlier. I would look forward to continuing the conversation. Thank you for actually having this conversation. As I said, I do think it is through these conversations that our thinking advances. So thank you.
Sandro, it's been a real pleasure. Thank you, everyone, for tuning in today. Please tune in next week. We will be speaking with Microsoft at the JP Morgan Healthcare Conference, as well as a number of other incredible leaders throughout big tech, big pharma, big biotech, a host of live interviews from important companies like Accenture, like Deloitte, JP Morgan. This will really be an extension of this discussion, which is how do people from diverse backgrounds come together and solve problems within healthcare. It's part of what we call our Iconic series, and I welcome you into the 2024 era of Endeavor Better Health webinars, podcasts, and an extension out to our new media partners in biospace and in other incredible organizations that feel compelled, as Sandro was saying, to talk about difficult issues in healthcare and the decision-making process to advance early-stage companies, innovation, and technology in an ethical way. Sandro, thank you once again. Stay tuned.
You.
Don't leave yet. I'm just going to sign us off.